November is Hospice and Palliative Care Month. It's something a lot of folks probably don't know much about until they really need it. So Dr. Oliver Sequeira is here from OU Tulsa to help us understand kind of the differences. So Dr. Sequeira, welcome.
Thank you for having me.
We wanted to talk about, this is obviously a tough subject, but something that everybody needs to talk about, hospice and palliative care, because palliative care, you were talking about, it's much more broad than just hospice.
Absolutely. So palliative care, well, first off, I'll say you're very right. It's very tough to talk about these things. And so palliative care, and to know the difference between palliative care and hospice, the palliative care side is, we have to define it. And palliative care is specialized care for people with serious illnesses. We focus on relief of suffering. Some people have physical suffering, say from pain. Some people have spiritual suffering, let's say. So we help address all different kinds. We also help to improve quality of life, which can be easily affected by serious illness and the treatments we use for the serious illnesses. And then we also help to preserve dignity. Now, the nice thing about palliative care is that it can be done along with what we call curative care. Okay, so as let's say for example cancer, we can get chemotherapy with an attempt to cure the cancer, and also there's symptoms that come along with it from the disease itself, from the treatments that palliative care can help treat. Sometimes with some diseases you get to a point where cure is just not an option, unfortunately. And at that point, patients have the option to go with hospice, which is 100% palliative care.
And so, doctor, I mean, when you're talking about with patients or hearing about patients who struggle with end-of-life decisions and their families who struggle with these decisions, is it kind of a thing where they really just don't know where to start? I mean, is that a common occurrence?
Absolutely. That's a great point. One of the things that we do in palliative care is also to provide honest information and to provide it to patients and families, because there's a lot of proverbial cooks in the kitchen, and that's one of the things about palliative care, is that we are that source of information for patients and families. And I want to be clear, we take care of patients and their families together. Okay, it's a whole thing.
Because sometimes in these end-of-life situations, maybe patient is at the point where they're going to need their family to help make decisions for them.
Absolutely, absolutely. And that's exactly correct. You're spot on.
Well, Dr. Oliver Sequeira, thank you so much from OU Tulsa.
Appreciate it. Appreciate you having me.
Yeah, absolutely. And so the Tulsa City County Library, here's the thing. They're hosting a free public talk about this tomorrow, Thursday, from 6 to 7:30 at the brand new Central Library.